patient with reflex syncope starting to feel dizzy needs to be aware that something has to be done, because it may not go away, this feeling of dizziness. And the actions are, after being aware that there's danger, maybe simply just to sit down. It might be enough. If the patient is used to a fairly long warning period, like 30 seconds to a minute, then they could perhaps leave the room in which they are feeling dizzy. But if the warning's short, don't try to leave the room, because there'll be an accident on the way out, and it's better to sit down. If there's no chair, then sitting on the floor is possibly necessary, maybe socially difficult, but social concerns have to go out of the window at this point. And so sitting down, sitting on the floor will help. And the other thing that patients can do immediately, which will be very helpful, is this kind of maneuver, so-called isometric exercise. Link the fingers like this and pull. And you may be able to see that I'm working at it now. And probably my blood pressure has gone up 30 millimeters of mercury, or 30 points, as a result of this. Again, if they're on a chair, then crossing the legs and pressing them against each other and doing this. Now, why? Well, this is isometric exercise, which means the muscles are tense and working, but they are not moving. And this raises the blood pressure. So we see this on the tilt table when we're testing patients. If we ask them to do these things, we can get the blood pressure to come up 50 points with both those maneuvers together, 30 with this. So a patient who's feeling dizzy is going to have a blood pressure less than 80 systolic. That's the upper figure. And to put it back to 110 by this action will make them feel better. They can't, of course, continue to do that. So they'll relax and the dizziness may come back. And in that case, they have to do it again. Now, if that's not sufficient, the only thing is to lie flat. And that is really socially difficult, because the floor may not be clean. There may be people around who think, who's this odd person behaving in this way? And people are not sympathetic, which is disappointing, but it's a fact. But may be necessary. And I always say to ladies that if they have this tendency, it's much better to wear trousers than a skirt, because the final treatment which the patient can manage, him or herself, but particularly in this case herself, is to lie on the floor and put the legs up against a wall. Now this will give an auto-transfusion of blood out of the legs into the body, which will reverse the problem in most cases. But you can imagine that this is not very easy socially.